Now, as we've been hearing this morning, it appears the UK is on its way to meeting its first target for the national vaccination rollout. But a new report in the Lancet warns that vaccines will fail to achieve their full potential without an effective global immunisation strategy, meaning people all around the world can get vaccinated. Well, I'm joined now by one of the authors of that report, Dr. Olivier Wouters. Good morning to you. Thank you very much for joining us. So what exactly is the position with sharing vaccines globally and countries getting to the point where they can offer surplus supplies?
Well, good morning. The situation at the moment is quite imbalanced, where you have a number of richer governments having secured lots of doses of vaccines for their populations. Countries like the UK, Canada, others have secured enough doses to vaccinate their populations many times over, in fact, whereas there are dozens of countries around the world that have yet to vaccinate their first individual.
And how do you estimate the willingness of countries to share vaccines?
Yeah, well, the early days now haven't been particularly promising, but hopefully, so I should say, many of these deals or these stocks of vaccines that the UK government, other rich governments bought were early in the pandemic when we didn't know which vaccines would work or not. And now that we know that many vaccines do work and countries have secured enough stock for their populations, once you hit these targets, so say now the UK is able to vaccinate its highest risk groups, its frontline NHS workers, at that point you can take stock of the situation in a country and say, well, look, we have enough now for these really high risk individuals. We can make sure that the World Health Organizations and poor countries around the world get at least some doses now to start to vaccinate their own really high risk groups.
And will we be relying on countries to be purely altruistic, or will they be made to share any surplus?
Well, again, it's hard to make anyone do anything, but I would urge governments, it's not just the sort of moral argument, it's also for self-interested governments have an incentive to make sure that there is a global strategy. We've started to see these new mutations emerge from in countries like South Africa, Brazil, mutations in this country as well. And some of these new variants are potentially undermining the efficacy or the effectiveness of existing vaccines. So all governments really have a stake in this and should promote and treat this as a global problem.
And what are some of the other consequences if other countries don't have access to the vaccine that will actually relate to all of us?
So I think there are also economic consequences, right? We live in an interconnected world. This country is particularly interconnected. So unless we want to live with travel restrictions and a hit to our economy for a prolonged period of time, we also have an economic incentive to make sure that governments around the world are able to vaccinate their populations.
We ran a report earlier from our Africa correspondent, John Sparks, from Mozambique, and he was speaking to medics there who were suggesting that they weren't likely to get access to the vaccination for between 3 to 5 years. I mean, that's really quite depressing.
Yeah, I mean, again, I think once a country like the UK, like the US, other richer governments around the world have vaccinated residents in care homes, frontline workers, health workers, at that point, it makes sense to start to share with other governments like these so that, they can start to vaccinate their own elderly populations, their own frontline workers. I think that's discouraging to hear that.
And I suppose ultimately what we're looking at perhaps increased production of the vaccine, are we?
Yeah, so I think that is...
And affordability.
Exactly, I think both of those are important. The bottleneck at this point in time is really production. If we had enough doses to go around, we'd be less concerned about which countries are at the front of the queue or a bit further back. So absolutely, I think we need to ramp up production. We need to make sure we have enough doses to go around. And then, of course, these vaccines are priced affordably, so governments can pay for these vaccines and the vaccination programs that go with them.
Thank you very much, Dr. Olivier Wouters, for speaking to us this morning.
Thank you.